The biggest barrier preventing precision cancer medicine from being widely adopted is a lack of knowledge on the part of oncologists, frankly, about precision cancer medicine and the breadth and depth and scope of it, what it's capable of versus what is done in standard of care facilities. Even in facilities like Mayo, MD Anderson, and Johns Hopkins, it's not uncommon for patients to pay quite a lot of money for a second opinion and not receive any additional diagnostics or no additional genetics that are going to help inform their treatment. So the main reason for that, I think, is because the folks on the front line who are prescribing the medicines for the patients, they were largely trained in a time before precision cancer medicine was a thing. I mean, it's only been since 2003 that the Human Genome Project concluded, and kind of really in the last 10 years that there's been enough testing resources and enough treatment options for oncologists to really see the benefits of precision cancer medicine, but they're not well trained in it. One of the statistics that came out of a US study this last year from some high-end research hospitals, so the people who are on the front lines, those doctors were surveyed, and only 20% of them said that they had even moderate confidence in how and when to use precision cancer medicine, with the use of genetic testing or tumor DNA, RNA, that kind of thing, testing, and then the therapies that helps to match patients to. So really the biggest barrier, I think, is that a lot of oncologists don't really understand what's possible because their cancer agencies simply don't do that kind of testing. And so they never really understand the scope and breadth of the testing that can be done, let alone all of the treatment options that patients can be matched to. So I think that really is the biggest issue that needs to be resolved.